When generating objective session notes as an RBT for service verification purposes, it's important to follow legal, regulatory, and workplace requirements. Here are key points for RBTs to consider. 1. Adhere to confidentiality. Ensure that session notes adhere to client confidentiality guidelines. Avoid including any personally identifiable information unless necessary for treatment purposes. 2. Use objective language. Write session notes using clear, concise, and objective language. Focus on describing what occurred during the session based on observable behaviors, actions, and interventions. Avoid making assumptions or including personal opinions. 3. Document relevant information. Include important details about the session, such as the date, start and end times, location, and individuals present. Capture the purpose of the session and any specific goals or objectives addressed. 4. Describe behaviors. Document the client's behaviors and responses observed during the session in a factual manner. Use specific and measurable terms to describe behaviors, such as client-made eye contact, client engaged in self-stimulatory behavior for 5 minutes, or client-initiated communication with a peer. 5. Note interventions and strategies. Include a summary of the interventions and strategies implemented during the session. Describe the techniques used, prompts provided, reinforcement procedures, or any modifications made to the treatment plan. Highlight the effectiveness of these interventions when applicable. 6. Record data and progress. Include data points and objective measurements related to the client's progress. Use graphs, charts, or tables to present data accurately. Document any notable changes or improvements observed and compare them to baseline or previous session data. 7. Include collaboration and communication. Note any collaboration or communication with other professionals involved in the client's treatment. This could include coordination with the BCBA, discussions with parents, or consultations with other therapists or educators. 8. Document incidents or challenges. If any incidents, challenges, or concerns arise during the session, document them objectively. Include details about the incident, any relevant actions taken, and the resolution if applicable. Follow any reporting protocols established by your workplace for such incidents. 9. Follow timely documentation. Complete session notes promptly after each session while the details are fresh in your mind. Timely documentation ensures accuracy and reliability of the information. Adhere to any workplace policies regarding the timing of documentation. 10. Review and verify. Before submitting session notes for service verification, review them carefully for accuracy, completeness, and compliance with legal, regulatory, and workplace requirements. Verify that the information provided aligns with the observed behaviors and interventions implemented during the session. Remember to familiarize yourself with specific legal, regulatory, and workplace requirements regarding session note documentation. Different organizations may have their own templates, formats, or additional guidelines to follow. Consult with your supervisor or employer for any specific documentation procedures and expectations. By generating objective session notes that accurately reflect what occurred during the sessions, you contribute to service verification and maintain compliance with legal and workplace requirements.